Good evening, everyone. I hope I'm audible and visible. If I'm audible and visible, can I see a quick thumbs up on the live chat, please? I hope you're all relaxed after the exam. And so I'm welcoming you all to this Fmge Jan 2024 Biochemistry Recall session. And echoing, is there an echo? Good evening, Tofik. Good evening, all of you. Noisy voice. Noisy voice. One second. How is it now? Am I audible? Okay. Okay then, fine. So I can see that you're all fine now. Okay. Let me start the session with a disclaimer. The questions discussed in this PowerPoint are recall based. And the main aim of this live session is to get the actual question from you all. And the final questions received after discussion will be uploaded on the PrepLadder app soon. Okay. And before we start biochemistry part of this discussion today, vitamins, there were majorly vitamins, right? I understand. And before we start the biochemistry part of the session today, I would like to show you all this. This is a poll that we conducted, and the good news, what we felt very happy about is most of you had told that the paper was moderate and towards easy and very easy, right? So in comparison to the last time, I think the paper was pretty easy. Most of you said it's moderate and many of you said it is easier, right? Yes, it's always vitamins, I agree. And in biochemistry, this is the split up. I got all the questions, most of the questions I've received from all the students. And in biochemistry, there were 19 MCQs. I would say this is the highest in all the recent papers. 19 MCQs, out of which the split up was 5 vitamins, 5 amino acids, 5 core biochemistry MCQs, 2 clinical biochemistry MCQs, 1 was on minerals and 1 was on genetics, right? Yeah, so this is the split up that I have, right, based on all the MCQs that I've received so far. So as always, it remains the same. Do not attend Fmge exam if you have not prepared for vitamins. Or let me put it in a positive way. Prepare yourself for facing MCQs based on vitamins before you appear for your Fmge exam. Okay? So, yes. So this is the first question that I would like to tell you all about. In arterial blood gas analysis, which of the following is derived or calculated? So this I told you so many times. The one value which is calculated is bicarbonate, choice D, because any arterial blood gas analyzer has got an electrode for pH, an electrode for estimating oxygen, an electrode for estimating carbon dioxide. But what is not available? Bicarbonate electrode is not available. So the analyzer calculates bicarbonate value based on Henderson-Hasselbalch equation. So which is calculated among all these? It is bicarbonate. That is why in all arterial blood gas analysis reports, it will be written as C bicarbonate. So what does C here stand for? C stands for calculated bicarbonate values. Okay, good. The next one, defect of tyrosine transaminase causes. What is the right answer? This we have discussed so many times in our rapid revision videos, right? In YouTube, we conducted last resort revision for Fmge aspirants, in which I told you about all tyrosine metabolism disorders. So defect of tyrosine transaminase causes type 2 tyrosinemia. Okay, so I also asked you to remember it as tyrosine transaminase has got 2 T's. So it is type 2 tyrosinemia, and 2 we have 2 I's. I have also asked you to remember it as 2 I's. So type 2 tyrosinemia will present itself as oculocutaneous syndrome. Right? Oculocutaneous syndrome. So they present with painful corneal erosions and palmar hyperkeratosis. Okay, so answer here is type 2 tyrosinemia. The next one, a child presents to the clinic with fatigue, joint pain and swollen gums. Physical examination reveals petechiae on her skin. Which of the following can be given to treat this condition? So can you see that there are bleeding disorders, right? Revealing petechiae, joint pain because of joint hemorrhages. So all these can be treated by giving what? Vitamin C. Albinism was given in the question. Yeah, can be treated by giving vitamin C, because vitamin C is essential for collagen maturation. Yeah, have I told you this? We have already discussed vitamin C acts as a coenzyme for prolyl hydroxylase and lysyl hydroxylase. Both these enzymes help in forming collagen cross-linkage formation that is essential for maintaining the blood vessel compatibility, right? So once the blood vessel subendothelial tissue becomes weaker, that causes bleeding. So that bleeding can be treated by giving vitamin C. Very good. A patient presents with a combination of Castle's necklace. No albinism, very big question. Okay, so probably for type 2 tyrosinemia, they give you a case history wherein they must have told you something about eye. Did you see eye manifestations in the question? Corneal erosions and corneal scar. So had they given you corneal erosions and corneal scar, it is oculocutaneous syndrome, type 2 tyrosinemia. The enzyme defect is tyrosine transaminase. Is that clear? Yeah. A patient presents with a combination of Castle's necklace, cheilitis and stomatitis. Upon further investigation, it is discovered that the individual has a diet deficient in a specific nutrient. Yeah, last question was clinical and no. Had they given you something related to cornea, it is type 2 tyrosinemia, Dr. Abi. Okay. So diarrhea was also mentioned. Then it is classically 3 Ds of Pellagra, right? Diarrhea, dermatitis, dementia. And many of the students had chosen it wrongly as riboflavin deficiency just because they saw stomatitis. So angular stomatitis is not only a feature of riboflavin deficiency, it can also be a manifestation of niacin deficiency, where we call it as stomatitis. Okay. So what is the answer here? It is niacin deficiency. Sunburn. Okay. Sunburn and necklace, is it? Okay. So it is basically photosensitive dermatitis. Castle's necklace is nothing but photosensitive dermatitis. On sun-exposed areas, you see manifestations. And then cheilitis, stomatitis, and then diarrhea. So that will be 3 Ds of Pellagra caused by niacin deficiency. Yes, stomatitis and cheilitis. Okay. Photosensitivity, yes, photosensitive dermatitis. Which of the following is a precursor of niacin? So some of the students said the question was tryptophan can give rise to which of the following? Some of them said which is the precursor of niacin. In either case, all that you need to know is tryptophan is a precursor for niacin. So what are the specialized products that you can get from tryptophan? One is niacin, the other one is serotonin, right? Serotonin, melatonin. So these are the 3 specialized products that you get from tryptophan. Okay. A lactating mother, this is a very interesting case-based MCQ. A lactating mother who follows a strict vegetarian diet presents with fatigue, weakness and numbness in her extremities. Upon examination, her blood work revealed a decreased total iron binding capacity. Which of the following deficiencies can cause this clinical picture? So I was told that there is a history of anemia in this lactating mother who is on a complete vegetarian diet, plus neurological manifestations. So whenever you see anemia plus neurological manifestations, think of B12 deficiency. So as I've always been telling you, whenever you're given a case-based MCQ, start excluding choices one by one. So why am I saying this is not iron deficiency? Had it been iron deficiency, what should have happened to total iron binding capacity? It should have increased. Because total iron binding capacity is a measure of transferrin. So when there is iron deficiency, transferrin level increases. So had it been iron deficiency, there should have been an increase in total iron binding capacity. So that is excluded. And are you thinking of folate deficiency? A vegetarian mother should not present with folate deficiency. You should remember vitamin B12 sources are all non-vegetarian, animal sources. So a strict vegetarian is prone to develop B12 deficiency. Also, folate deficiency can present only with anemia. It does not present with neurological manifestations. So what is the take-home message for all of you? Dietary history vegetarianism plus anemia plus neurological manifestation should be vitamin B12 deficiency. Okay? Yeah, xerosis. I have that MCQ also. These are two different questions. Okay. Vegetarian diet always B12 deficiency. Yes, medico. Mostly vegetarianism causes B12 deficiency. Iron absorption is decreased by which of the following? What is the right answer? Yeah, we know that iron absorption is decreased by intake of tea. Right? So I want you to remember one fact. Iron gets absorbed better in the form of ferrous. Right? Iron absorption is better in the form of ferrous. And most of the animal sources of iron will be in the form of ferric. So first you have to convert ferric into ferrous, for which you need an antioxidant, a reducing substance. And the reducing substance is vitamin C. So suppose your patient comes with iron deficiency, and if you want to improve iron absorption, what you can give is you can add vitamin C to the patient. For example, if you are saying that you can take green leafy vegetables to your iron deficient patient, say that in the spinach, in the green leafy vegetable preparation, instead of adding tomato, add lemon. Right? To add the tangy flavor, the person can add lemon, and lemon will act as a source of vitamin C that will promote iron absorption. So amla and lemon will increase iron absorption. Sprouts act as a major source of iron. Right? So 100 gram of take it from me, 100 gram of sprout can take care of the 7% of daily requirement of your iron. Okay, so sprout. So what is the right answer here? The right answer here is tea, because tea is rich in phytates. Phytates will inhibit iron absorption. Neha, if you are not happy about this, you can give me the right question. I am more than happy to give you the right answer. Okay? I am here to help you out. We were lucky, these were some, most of the questions we discussed in the last resort revision. Okay, I am not here to waste anybody's time. If you can give me the right question, I will be able to give you the right answer. Okay, which of the following deficiencies causes xerophthalmia and follicular hyperkeratosis? Have we discussed about this so many times, right? So follicular hyperkeratosis is, what is it? Xeroderma. Phrenoderma. So have I showed you this image always? So phrenoderma or follicular hyperkeratosis is caused by vitamin A deficiency, because vitamin A suppresses keratinization. So only in vitamin A deficiency there will be excessive keratinization, which presents as phrenoderma or follicular hyperkeratosis, and excessive keratinization will cause dryness of conjunctiva, which is xerophthalmia. So what is the right answer? The right answer is vitamin A. So xerophthalmia, xerosis, all mean the same, right? Conjunctival xerosis, xerophthalmia, corneal xerosis. So all these means hyperkeratosis. What is the most common cause of night blindness in pediatric age group? Because we discussed about vitamin A previously, I thought I will club this MCQ also. The most common cause of night blindness would be vitamin A deficiency. So lactulose. So we have discussed so much about lactulose. I taught you that lactulose is an osmotic laxative. Right? It's an osmotic laxative which when ingested by an individual, because it cannot be digested by our enzymes, cannot be absorbed. When it cannot be absorbed, it stays back in the intestinal lumen, attracting water, and that causes osmotic diarrhea. So it is an osmotic laxative. And why do you think it cannot be digested? Because it's different from lactose. What is lactose, all of you? Lactose is galactose and glucose. And we have an enzyme lactase which can digest lactose to give rise to galactose and glucose. But what is lactulose? Lactulose is galactose and fructose. Right? Lactulose is galactose and fructose with the same beta-1,4 linkage which cannot be digested by lactase enzyme. So it stays back in the intestinal lumen causing osmotic diarrhea. Okay? Thank you, honest reviews only. Yeah. This is the next question. Which of the following amino acids are necessary for Purine ring formation? So this was also discussed in the last resort revision of Fmge on PrepLadder YouTube channel. So Purine ring, I've told you that there are 9 atoms. Let me first tell you the right answer. I know you're all anxious to know the right answer. The right answer is glycine, aspartate and glutamine. Okay, so what is the right answer? It is glycine, aspartate and glutamine. Okay, so Purine ring, for those of you future aspirants, please understand such questions can be repeated in your exam. Purine ring has got 9 atoms and each and every one of these atoms will have their own individual sources. N1, both of Purine ring and Pyrimidine ring, N1, the first alphabet is A, so N1 is always from aspartate. Okay. Similarly, N3 and N9, both of Purine ring and Pyrimidine ring, N3 and N9 are from glutamine. So we know aspartate, glutamine. And then C4, C5 and N7, all these 3, yeah, C4, C5 and N7, all these 3 are from glycine. So what are the 3 amino acids that are necessary for forming Purine ring? N1 is from aspartate, N3 and N9 from glutamine, C4, C5 and N7 from glycine. So what is the right answer here? The right answer here is choice B. Dr. Ritika Chauhan, this is the right answer. Whatever may be the other 3 options, had you chosen this would be the right answer. Okay, it is not galactose and mannose, it is galactose and fructose. Ammonia is transported from brain to liver in the form of which of the following amino acids? So this also we have discussed. Ammonia is toxic, so it has to be transported from various tissues to liver, when it can be converted to urea. From all other tissues, ammonia is transported as glutamate. Only from brain it is transported as glutamine. From all other tissues it's transported as glutamate. From brain it is transported as glutamine. Yeah, I have that MCQ also. Gayatri, you're right. There was also a question about hemoglobin and which amino acid, right? See, I have that MCQ. Hemoglobin is derived from which of the following amino acids? What is the first step of heme synthesis? The first step of heme synthesis is wherein glycine, an amino acid, reacts with succinyl-CoA in the presence of delta ALA synthase to form delta ALA. So which amino acid is necessary for heme formation? It is glycine. So whenever I discuss about glycine, I've told you always the uses of glycine. I've told you glycine is necessary for Purine ring formation. Glycine is necessary for heme formation. Glycine is the most abundant amino acid of collagen. So all these 3 we have revised so many times. So which amino acid is necessary for heme formation? It is glycine. So buffer to hemoglobin is histidine. Yeah, which amino acid is the buffer of hemoglobin? It is histidine. I have also told you this. pK of histidine is 6, which is close to physiological pH of 7.4. So histidine is the physiological buffer. Okay. So on PrepLadder YouTube channel, we keep uploading such high yield videos. So do not forget to subscribe to this channel and do not forget to like this video. Okay. Which receptor plays a crucial role in glucose uptake in skeletal muscle? So insulin dependent glucose uptake. Let me give you the right answer first. The right answer for this is GLUT4. So insulin dependent glucose uptake happens in skeletal muscle, cardiac muscle and adipose tissue, right? Skeletal muscle, cardiac muscle and adipose tissue. By which transporter upregulation? By GLUT4 transporter upregulation. Okay, answer is D. Had they asked you neurons or RBCs? Neurons or RBCs, it is GLUT1. So you all told me this question, right? What is the rate limiting enzyme of cholesterol synthesis? How did I ask you to remember this in the last resort revision video? I told you statins act by inhibiting Hmge-CoA reductase. We all know statins reduce blood cholesterol level and they act by inhibiting Hmge-CoA reductase, which is the rate limiting enzyme. Adipose tissue was mentioned. Yeah, even in that case, it's GLUT4 transporter. Okay. Carnitine acyl transferase 1 is the rate limiting enzyme of fatty acid oxidation. Carnitine acyl transferase 1 is the rate limiting enzyme of fatty acid oxidation. The rate limiting enzyme of HMP shunt is, what is the right answer for HMP shunt? It is glucose 6-phosphate dehydrogenase. Okay, glucose 6-phosphatase is an enzyme of gluconeogenesis. Glucose 6-phosphate dehydrogenase is the rate limiting enzyme of HMP shunt. So answer is choice B. Mitochondrial matrix enzyme. So all these are core biochemistry MCQs. Do you see that? Mitochondrial matrix enzyme. So I told you about marker enzymes of every suborganelle. When we discussed that, I told you monoamino oxidase is for outer membrane. This is for outer membrane. This is not a mitochondrial matrix enzyme. ATP synthase is a marker enzyme for inner mitochondrial membrane. I also asked you to remember it as inner mitochondrial membrane is where you have electron transport chain complexes, and ATP synthase is complex 5, which is present in the inner mitochondrial membrane, not in the matrix. Catalase is the marker enzyme for peroxisomes. Right? Peroxisomes are so called because they keep generating hydrogen peroxide. And to detoxify hydrogen peroxide, they are provided with catalase. Catalase is not present in mitochondria. So what is the right answer? The right answer is citrate synthase. Right? So we know that citrate synthase is an enzyme of citric acid cycle, and citric acid cycle happens in mitochondrial matrix. So that is the right answer. Samuel, what am I telling you? The right answer is mitochondrial matrix enzyme is citrate synthase. I didn't say catalase, it's citrate synthase. So this we have discussed, right? I told you exactly a similar MCQ in the last resort revision of Fmge. If they give you RNA sequence, how to find the template strand sequence? If they give you template strand sequence, how to find out the RNA sequence? How did I ask you to remember? I told you that template strand and RNA will be complementary and anti-parallel. Do you remember? It will be complementary and anti-parallel. So if this is the RNA sequence, your template strand sequence has to be complementary. And what is the polarity with which RNA sequence is written? RNA sequence is written in 5' 3' direction. So what is it? 5' CAA GGU 3'. This is the RNA sequence. Now write complementary sequences. G, T, T, C, C, A. These are the complementary sequences. And what is the polarity? 3', 5'. So what is the direction in which you have to write every sequence? It can be template strand sequence, it can be coding strand sequence. All these sequences should be written only in 5', 3' direction. So when you write it in 5', 3' direction, what is the right answer? ACC TTG 3'. Right? What is the right answer here? The right answer is ACC TTG. So what will be the right answer here? The right answer here is choice C. I told you all these stepwise, right? So what will you do if they give you RNA sequence, they ask you to find out template strand sequence. First write the polarity as 5', 3', write complementary sequences, mark it as 3', 5'. But finally, you have to write the sequence only in 5', 3' direction. So what is the right answer? The right answer here is ACC TTG. LRR helped. I am very happy, Vaishnav. Okay. So which of the following electrolyte abnormalities is not a feature of refeeding syndrome? Right? What is the right answer? The right answer is hyperkalemia. That is not an electrolyte abnormality that is seen in a refeeding syndrome. What is refeeding syndrome? It is a metabolic disturbance that happens once you reconstitute feeding in a person who had been starving for a prolonged period of time, who had been malnourished for a prolonged period of time. So in that case, when you start feeding the individual close to the 4th day of refeeding, they many a times present with what? Hypokalemia, hypomagnesemia, hypophosphatemia. What is the reason? Once you start feeding, glucose level increases. When glucose level increases, insulin will be released. And insulin is an anabolic hormone. When it stimulates all anabolic processes, phosphate will be used. Right? Phosphate will be used. That causes hypophosphatemia. And for most of the kinases which are used for anabolic pathways, magnesium is used. That is why they present with hypomagnesemia. And insulin stimulates sodium potassium ATPase pump. What does this pump do? This pump pumps out sodium ions, reciprocally takes in potassium ions. Already the person is potassium depleted because of the malnourishment. Now this insulin causes further intake of potassium into the cell. So what will it cause? It will cause hypokalemia. So what are the electrolyte abnormalities that you see in a refeeding syndrome? Just remember, high glucose, high insulin. So all anabolic pathways happen, phosphate gets used up, hypophosphatemia, kinases need magnesium, so hypomagnesemia, insulin stimulates sodium potassium ATPase pump, so hypokalemia. Thank you, Nishant. I am very happy that you are very benefited. Yes. So answer is hyperkalemia. Iron absorption is increased in the presence of vitamin C. It is decreased in the presence of T. Does that answer your question, RSR? So these are the 19 MCQs that I got from students. And I think one more MCQ which I was not told is also included here, which is the physiological buffer. The amino acid which acts as a physiological buffer is histidine. So totally 20 MCQs from biochemistry. Most of the MCQs were from vitamins, and most of the MCQs we had already discussed in last resort revision. And this is one MCQ which I did not discuss in last resort revision because I did not discuss about electrolyte abnormalities, but the answer here is hyperkalemia. Okay, so thank you all. I hope all of you got benefited, and if there is any other MCQ that you can recall, you can type it in the chat box. I will be active, and if I see any MCQ that I missed, I'll give you the answer right away. Okay. So do not forget to subscribe to PrepLadder YouTube channel, and do not forget to like this video. Yeah. Thank you. Thanks everyone.